to record. Ayan. All right, can you hear me? Thank you, thank you. Oh, just grab my notes. Yes, thank you. How are you? Kamusta?
Okay naman po. How are you? Congratulations with the new clinic.
Thank you. Thank you. I'm great. Thank you. It's, as you know, it's always busy anyway, regardless whether I have a new clinic or not. We are doctors here in Australia. It's always busy, but at the same time, we are feeling blessed because we are busy and we are productive and we are doing what we like to do. We are grateful that we love what we do and we're having fun, we're enjoying, and we're doing extra by doing this Zoom, trying to fit in this Zoom to share your journey to our colleagues in the Philippines so that hopefully they will be inspired and learn from you, learn from this Zoom meeting. So thank you very much for joining. Last minute invitation.
Isang sabi nyo lang.
So, we'll start off with a quick introduction. I think I introduced you already dun sa sinend ko sa'yo na bio. But maybe just a quick introduction about you. Tell us who you are and why you decided to say yes to this interview.
Yeah, okay, so without divulging my age, I finished med school from UST, what was that, 2007? And then right after boards, I went into training, internship, of course. So I did internship with DOH, and then straight to residency training. So I completed my training in general surgery at St. Luke's, Quezon City. And then it was always in the pipeline because I have relatives here. I have a brother and a sister here. So it was always planned somewhat. So right after the Diplomate exam for surgery, I did the AMC 1. So it's been quite more than a few years since I've done the AMC 1. And then after that, medyo na-derail yung plans, life happened. And then it's after COVID, parang medyo nag-shift yung priorities. So I decided to bring it up with my husband, the concept of trying it out here. It was a big risk for both of us because we knew that we would start again from more or less from scratch. So we were okay na sa Philippines. We were settled. We were comfortable. So I'd schedule my surgeries, and then afterwards, kung tapos na yung clinic, I'd have the day to myself. For rounds, before ako mag-rounds, may update na yung residents sa phone ko. My patient was overnight and in the morning. So it was, I knew all of that would be like, I don't want to think of it as giving up, but it's something that, you have to brace yourself that it's going to be different from that lifestyle that I have been accustomed to for a decade now, more than a decade na din akong consultant, and my husband, he's non-showbiz, but he's also okay na with his job. So it was a big risk for us, pero I would say calculated risk naman siya, hindi naman siya, bigla lang at a whim. So it was, so that was last year. And then I decided that the point of entry na gagawin ko was student. So I applied for master's in Curtin. My course was in health administration. I was with a few other Filipino doctors with that course, but they were much younger than me. So also same pathway that we were thinking of finishing health administration, because we looked up the list of the skilled list ng immigration. So it was on there, aside from the physicians, the medical practitioner, included ang health administration.
Meron akong question. Let's go back. So your siblings are here in Australia. Are they in Perth?
Yes, Papa. West Australia, my sister's in Bunbury, my brother's in Perth. So every time we would come and visit, usually stay either in Bunbury or here in Perth.
So you've been here in Perth before deciding to study health admin, or first time mo lang?
No, I've visited Perth before.
Okay.
I was also open to going to universities in the East, but it would have been easier for us to do it here because my sister has she's based in Bunbury. She also has another house here in Perth, so libre rent habang student. So that was a big help for me to decide that let's try this.
So if I may interrupt, so consultant ka na sa Pilipinas for 10 years, you have a comfy and well-settled lifestyle. What's the change? Bakit? What's the big why? What's the big dream? Why all of a sudden do this calculated risk?
Yeah. So as I said, it was always somehow planned, but it was always just in the back burner. Practice muna ako, mag-ipon muna ako, mag-asawa muna ako, mga ganyan. And then, after COVID, it was maybe yung parang shift na hindi naman not too much work, but my siblings sold Australia on me with the work-life balance. They're not in the medical field, but they're both professionals and they've worked in the Philippines. So, kasi malaki yung age gap namin. So, I've seen them when they were in the Philippines working and when they were here. And they'd be here for dinner time. They'd be home for dinner time with their family. Whereas in the Philippines, wala, they're still stuck in traffic, they'll get home late, yung mga ganyang bagay. Though I don't have kids, it was very appealing to me.
What is appealing to you apart from that work-life balance? What else? Why give up, say, you said calculated risk, almost start from zero? Why? Why do that yourself? Kung successful ka na sa Pilipinas, di ba? Comfy ka na
That was the first, I think that was the foremost, yung I don't want to be working hanggang pagtanda ko. May ganong thought. And then I think my husband was like, because this was always my plan. I took the exam way before I met my husband. So it was his idea. It was his parang statement that if we're not gonna do it now, how would we know that it wasn't for us? Parang, yeah. So it was that weighed heavily on me na, oh nga, kilad pa. I mean, I'm not getting younger. So I've always thought of it. I took the test, 2015. So it was always there. And then maybe yung parang desire for something new bubbled up after the mess that COVID brought on. So I think that again, tapos yung appeal ng, again, but Australia is famous for work-life balance. It was very, that parang that clinched it for me.
So
And
did you?
since again, alam kong I have support system here. So that's also a big factor for me. I mean, siguro kung wala akong titirhan when I got here, medyo magpapanik ako ulit. Parang yung mga ganon na with it's hard to find a rental place and all that. So medyo malaking factor din yung family ko that supported me.
No,
It was very big also.
No, nag-research ka for a student visa and a course. Why health admin?
My field was in surgery. Unfortunately, UWA has a master's in surgery, but I think they're only open to citizens, not to international students. So that was out.
Yeah.
My pre-med was in biology. However, I don't have any work experience with bio. So there is no like progression. So it was really medical that I decided to do a postgraduate course on. So health administration.
Nag-ano ka ba?
It's always a backup plan. I was thinking, like, I mean, in surgery, you get old, your neck would hurt with the long surgeries, you might get tremors, it's tiring. So I'm not saying health administration is an easy job. It's definitely not, but it can be a backup plan for like when you get older. So that was my thought process. It can be something I can do later on when I decide to retire, quote unquote, from surgery or there. Parang yun yung idea ko.
Nag-agency ka ba? Nag-recruiter ka ba? O how did you get into study health
I
admin?
actually applied initially by myself with Murdoch, and then they got back to me saying that I had to go through an agent. So I did that.
Okay, very good.
The agent, I'm sorry, ma'am.
Yeah, continue. The agent.
So if anybody's like thinking of doing like postgraduate studies, the student agents, education agents in the Philippines, wala silang charge. So if they're charging you or anything, no,
Bogus yun.
tell them their services are supposed to be free because the government is doing something for them. So yeah, just that. Kasi at first I was also hesitant to go with an agent because all of this, that you hear the scams that go on. So, but okay, sabihin ko na lang, IDP, and then actually changed into another agent. I forgot though kasi nabagalan ako. Sorry. But the education agents were very
I-send mo sa akin yung link para ma-forward natin sa mga sa mga participants today. Send mo sa akin yung link para ma-post natin dun sa Facebook group.
Hanapin ko lang.
Okay, that's okay.
But they're very helpful. They're very helpful.
So nakarating ka na dito sa Australia last year, nag-aral ka ng health admin for 6 months, and then what happened?
Actually, while I was doing the semester, which was hard, it wasn't a walk in the park. I was like, my Filipino classmates were also doctors. We were like, I don't think we studied this hard in school. Anyway, it wasn't a walk in the park. We were thinking, sige, baka chill lang and all that. No, it was not. So anyway, in the middle of when I would find time, I submitted applications, which was also time consuming in itself because you'd have to do the selection criteria. Well, first thing you have to read the job description if you're even eligible for it. And then secondly, you do the selection criteria. You have to answer the questions. So for every job application that you submit, you do that. So that's very nakakapagod. It was like, when was the last time that I did an essay? I mean, college, not even. I mean, high school. So it was all very, but
I know
essay
what
na
you
naman.
mean.
Essay talaga. So wala bang multiple choice? So it was so kaya that became very frustrating because I was it wasn't just, handing in a CV. I wish ever that easy that you have a ready-made CV, you submit to whoever. No, every CV would have to be accompanied by this selection criteria that you have to accomplish. So I was investing time and effort into it. I wasn't, half-assing the essays. I was seriously like answering the selection criteria. Nako, si Doktora alam to. She knows rejection after rejection after rejection.
So you
And then
applied all over Western Australia
everywhere,
and interstate.
everywhere.
Interstate,
I
diba?
applied hanggang Tasmania. I applied for all the roles. Sabi nga ni ma'am, ang advice ni ma'am, sige, applyan mo kahit anong role.
Yeah.
Kahit consultant, in-applyan ko. Sige lang, apply lang. O sige, wala namang bayad mag-apply. O sige, fine. So, I did.
So you're getting rejection or crickets? Are you getting email reply na rejection o wala kang nare-receive na reply?
For the majority, ma'am, I got, not immediate though. Siguro like weeks would go by before I hear anything from them. But I got the rejection letters. Very few lang yung hindi ako, or siguro na wala na sa isip ko.
Very
kasi
professional
nga,
naman
sobrang
sila.
dami kong, ma'am?
Very professional naman sila.
Opo, pero parang ano lang siya, parang pre-populated letter na siya. Sorry to inform you that your application was unsuccessful, ganyan-ganyan. You may reach out to this. So, nag-rewind ako kay Doktora noon. Siyempre, si Doktora, pinabuhay naman yung loob ko.
So,
sabi niya sa akin.
So, mamaya na natin sabihin yung exciting part. Mapuputo tayo in 5 minutes. Might as well cut it now. And then please go back. Don't have a paid Zoom. I did not invest on a Zoom paid pro anymore. So, it will be cut off in 5 minutes, but we'll cut it off now for everyone who's in Zoom now. Can you just follow and join and continue the most exciting part of your journey. Okay, I'll see you shortly, everyone.
See you, ma'am.